Hello, welcome to another in a series of State Department of Education webinars to assist districts in providing services to students, families, and staff during the COVID-19 restrictions. I'm Dr. Jocelyn Mackey, an education consultant with the Connecticut State Department of Education, and also a certified special education teacher, school psychologist, and intermediate administrator. I'm joined today by three experts from the field who will share some of their experiences and ideas on how to engage in self-care during this challenging time. Our first expert is Elias, a school psychologist who proudly serves the Meriden public school system. Eric is entering his 31st year of practice and has the distinction of being Connecticut's 2018 School Psychologist of the Year. In addition to his work in Meriden, Eric also co-hosts a bi-weekly podcast called School Psyched, and he is an active member of both the national and state associations of school psychologists. Having had several articles published on behavioral supports, Eric continues to contribute to the field of school psychology and evidence-based practices. Our next guest is Sandra Heller. Sandra is a school social worker at Platt Technical High School and has held this position for 17 years. Sandra has a particular focus on celebrating diversity and equity within schools. Her dedication to the field can be exemplified through a variety of activities, including participation as a member of the committee that develops state guidelines for school social work practice in Connecticut. Our third guest today is Eileen Melody. Eileen is a 7th and 8th grade school counselor at Mansfield Middle School in Storrs, Connecticut. She has been a counselor at the middle and high school levels for nearly 25 years and currently serves as the chairperson of the Connecticut School Counselor Association and member of the ACT Southern Connecticut States Organization. Eileen is also a member of the Social and Emotional Learning Collaborative and is an appointed member from the Connecticut Legislature. Thank you, Eileen, Eric, and Sandra, for taking time out of your very busy schedule to participate in this important conversation addressing issues impacting support specialists. Your role is key to ensuring that students have a safe and effective educational experience. And this responsibility is of particular importance during a period of uncertainty. So the first question I'd like to pose is, what are some of the most pressing issues and concerns you have in light of the heightened responsibilities that support specialists are experiencing during the COVID-19 pandemic?
I think I can address that first, Jocelyn. One of the struggles that support services, psychologists, social workers, school counselors are experiencing is engaging our students in the distance learning model. It's been very challenging. I think we all can agree with that. And yes, from a technology standpoint, but there are so many other factors that are that families are facing, and I think Eric was going to touch base on that.
Yeah, I think the pandemic has certainly revealed and exposed a lot of issues of inequity and access for students and families. And the two that I see are the biggest, at least from my perspective, are both trauma and equity. And while they might not seem connected at first, I think they are intertwined. I think issues of inequity, access to adequate food, health, online supports, access to devices, all of those things reveal the effects that some of our students are living in poverty, and their access to just being able to log in and participate in that learning is a challenge for some students. And so I see those as some of the biggest issues. And I also see teachers responding so effectively and strongly to reach out and connect. So I think in the same respect, there are so many issues there, but definitely a strong response in terms of trying to meet those needs for our students as well.
Thank you.
So I would agree that all of these issues have affected our work with our students during this time. And I would like to, in particular, note my colleagues who have young children who are home and trying to do a full-time job with their children and a full-time job with their school children, and really managing it amazingly. Because they're very committed. And I think that, that has been a very stressful 3 months for that group of professionals. I also think that one of the issues that we have as social workers when we're trying to have personal conversations with students, as we had to, continue our work with them that we had in school, it's really difficult to do when children don't have a private space. So that level of connecting is sometimes, it's very difficult to always know that you can have that. Some students may have that opportunity and many do not, because they have siblings in the home, they may have parents in the home, they have people in stress in the home if they are working, maybe have to adjust to working at home, or maybe they're not able to work and so they're trying to figure out how to work. So a lot of things changing in the homes that would not necessarily allow kids to connect with us on a very personal level, which can become really difficult when we have kids in crisis. Because we have kids that really end up in a crisis with this level of change. So that has been really connecting with them and trying to get them through this has been a challenge. But I will say that we have seen more stability throughout. Thank you.
So you've raised some really important matters, and providing guidance and assistance is a crucial part of the work that you do every day. Could you share some of the ways you have been able to provide supports to students, parents, and educators?
One of the ways that we as collectively as support services have been helping families through this time is we've been helping them create some meaning to their day. And, school was something that was expected. There was a routine, and families had adjusted to that as they do each year. And all of a sudden they didn't have that routine to rely on. So as support services, that was one of the first things that I think all of us did, was to help families create a schedule and a routine. And many of us did that in different ways. Sandra, as a school social worker, maybe you want to comment on that, how you did it?
Yes, thank you. Yeah, I think that we found sometimes the students were kind of paralyzed. It was like the first day of school again. Where do I go? What do I do? And so we were able to kind of sit with them and create a schedule. They didn't have a schedule. They didn't know what time they were supposed to go where. And at the technical school, we bounced back and forth between the academics and the trade, which makes it even more complex because it's a whole new rotation. So we would have to create a schedule for them. We would meet with parents and share the schedule with them. We had to make sure that the schedule was sent to them, and then they either took a picture of the phone so they didn't get lost in the email, because we don't have papers that we're giving to people. So creating that kind of base for them was critical before we could move forward. And then kids had to have codes, and they had to go to classrooms, and they didn't know the code. So actually going with them to a virtual classroom and clicking on the code and then asking the teacher, could we talk after the class is over? Like really taking steps to go through their parts of their day with them so that they could now have a new structure. That was really cute at the beginning.
Yeah, I love that. And I think we forget sometimes how we rely on technology for so much, but sometimes children need the basic stuff. And that structure occurs so naturally during the school day behind those four walls. And without that, we've really had to sort of recreate it for them. And I think about how intertwined are the adult positive relationship with positive adults in education, how intertwined that is with the instructional process, that it's not just sharing information, right? It's that connection with the caring adult or those caring, supportive adults. And so I think one of the things that teachers are doing that I've just been so impressed is focusing on that connection over perfection. You know, instead of just saying we're going to get the information out, we're making connections with our parents, with our students. And those are the things that build resilience, right? Those positive, supportive relationships. So I've just been so proud to be just part of that connecting process, staff, and seeing some of the things teachers have done above and beyond the outreach, the drive-by parades, the extra phone calls to check in, providing additional support maybe with a child who has an IEP, just to go beyond that to make sure that they're getting what they need. And I think that's just been so crucial.
Thank you. So we know that support specialists then are really best able to provide assistance to others when their own self-care needs have been addressed. And you've just shared a number of activities and responsibilities that you've been engaging in. Are there any strategies you found helpful in managing the current pressures that many of your colleagues may be experiencing during this time?
Well, I can jump in here. Just for me, focusing on resilience, assisting teachers in building resilience. And I think of some of the framework for resilience building, which includes positive connections, focusing on gratitude, positive reframing of negative thoughts, and making sure that time is set aside for meaningful activities such as mindfulness, exercise, relaxation, adequate sleep, adequate nutrition. I don't know about everybody, but for me, comfort food, lots of carbohydrates is kind of my go-to. And it's certainly not healthy under the most ideal circumstances. So just making sure that we get up and move, get adequate sleep, and are doing things that are healthy because we're just under extended pressure. I think assistant teachers remember that. For me, it's easy to talk the talk, but not always walk the walk. So just remembering that for myself as well.
And some things that I've been working on with, as supports to my colleagues have been, I've been collaborating really closely with them and attending some of their classes as they've been trying to develop lessons that address the students' social and emotional well-being. So as an expert in the field, they've been asking for me to participate, and I'm happy to do that. And I feel like I have been able to create like that feeling of being safe and making sure that our students feel like they're being heard, because when they feel like they're heard, we're validating them, and ultimately they're going to feel better about themselves as well. And another thing that I've been doing with colleagues and with students is just, as Eric said, is finding connection, learning about what their interests are, and sort of creating bridges using their interests and staff's interests. So it's been a different time for me as a support service person, and I've been trying to capitalize on the opportunity to be a resource to my colleagues in this way.
Thank you.
So I'd like to say that in our school, the structured collaborative meetings were critical to be able to connect and check in with one another, and to connect around what students need, and create, again, that structure for the student together, and for ourselves. But that checking in all the time was really a helpful process. And I think that going to the classes, sometimes with a student, and then kind of hovering at the end and maybe helping the student talk with the teacher afterwards, and just kind of letting the teachers know how they can get a hold of us, and that we're there. I think sometimes the teachers at the beginning, it was really kind of figuring it all out as well. So if they know you're kind of there with the student, we could make the connections together. But it was, it's been a really different way to connect virtually. But I think it's happening and it's been working. So I think that support systems that have been in place virtually have been very positive and helpful.
Thank you. So certainly support specialists have had to develop new skill sets or hone existing ones to meet the multifaceted needs of students during, a period of very rapid change. What important connections or resources have you relied on for assistance in effectively meeting the needs of the whole child?
So I think at the beginning of our quarantine, I probably read everything I could, everything that was sent to me that related to our new normal and helping teens through this. I went to webinars early along. Some of our other states had hosted them very quickly. And I think they confirmed that we were moving forward in the right direction. Our district social worker team met regularly. We created a Google Classroom of different resources that people were finding. And I think the resources that we were finding, like, we really needed them, especially right at the beginning. And so as quickly as we shared them, we were all taking them all in. And we were hearing consistency across information. So that was great. I myself set up a Google Classroom so that students could access any of those resources that I put together in that. But some of the organizations would have been SAMHSA or NAMI, our National Organization for Social Work and Counseling. I jumped into a webinar for counseling, and a lot of them were just click on the link and come in for an hour. And it was very, very helpful. One of the things that I did find also in my looking up resources was, links to little yoga videos that were 10 minutes or 15 minutes, mindfulness videos, and talking with kids about that, just breathing, helping them with just trying to relax, trying to find something every day where they can just look forward to it and just chill. But yoga by Adrian and for uncertain times was incredible. Yeah. Interestingly, I think a lot of other people have been on resource lists. I found her on my own, and then I saw her other places. But just sharing a link out to a group of students, they could just click on it and do a little 10-minute yoga. And quite frankly, my back is probably taking the brunt of some of this. My lower back, other people probably feel similarly about that. And yoga is amazing for that, also getting up and moving. But those are some of the things that I was able to share out and myself.
Mm-hmm.
Yeah, I think those resources, I think of each other. We have been the resources in a sense for one another. And I love the free webinars, just so many things that are available. There's a quote that I love that says, "None of us is as skilled as all of us." And so together, being able to share resources and ideas, everything from district staff meetings to personal PLCs, these little planned learning communities that colleagues are doing together, our state's communities of practice, and resources just on social media. People are, sharing a Google Drive that they've compiled of resources and counseling activities. And so I think we've sort of banded together to make things available as we've, jumped in without a whole lot of prep time for this. And to me, that's just been fantastic. It's been invaluable for me.
And for me, as the chairman of the Connecticut School Counselor Association, CSCA, we made significant efforts to hold meetings, regular roundtables. I think we had 8 in a row, just trying to help school counselors develop some telehealth skills, to problem solve. What are you experiencing? That was early on. And then we evolved into, well, what were elementary school counselor needs? What were middle school and high school? What were our graduate students needing? Because they were experiencing something different. So we really used the Zoom platform to reach people and to provide the supports that they need. And I agree with Eric, we were our best resource. We jumped out from as a board, the CSCA board, and went national and participated in national school counseling shares, we called them, which were very, very valuable to see how other places in the country who were a little bit further along than us, what they were experiencing and how they were sort of troubleshooting things for us. Yes, Sandra, I'm kneeling now because of my back. So I'm kneeling because I've done a lot of sitting these past 12 weeks.
Thank you. So you've each mentioned a number of really important resources. And so I'm wondering if there are any particular resources that you believe have been overwhelmed or more extensively utilized than others that might benefit from some infusion of additional supports.
Well, I think we all feel that if there were more of us, we've been overutilized, and happy to be of service. It's just, 1 person to 300 or 1 person to 400. Are we really meeting the needs as we as support service people would like to? Would we want to reach out to more students and families? This work takes time, takes sensitivity. We don't rush into it and just give a Band-Aid or give a simple answer to these complicated situations that students are coming to us with. So we as support service, I think, would benefit from more of us.
Makes sense.
Yeah, I would echo that. Personal and social and emotional resources and supports. And I think as we look to reopening, that needs to be part of the discussion. What will be the needs of our kids? They certainly, have required and need continued some social and emotional support. And as we look at regression academically, we'll look at behavioral and social emotional regression too as we hit the fall. And so those ratios that Eileen mentioned, supports available, and then personally, right? Because our emotions will, go up and down, and we need that self-care as we've talked about as well. So I think all of those resources have been exhausted, and we all feel it, and needing to continue to build ourselves up and be able to pour from that cup, as we fill that cup, be able to pour from that.
So I would echo what both Eric and Eileen have said. In terms of just resources beyond the people, I think we did experience some of the technology overload that made it difficult to kind of move things forward with the educational platform. So I think that those are some of the things that need to be thought about in the future if something like this should happen or as we go forward. But some of the communication systems and email and getting overloaded, so kids weren't really seeing them and parents weren't really seeing them. So, but I think we've kind of gotten through that part and figured out ways to communicate back and forth that are more effective.
So as time progresses, we inevitably must entertain thoughts regarding the upcoming school year. Are you finding that you're more focused on present activities and responsibilities, or engaging in thoughts of future challenges to be faced?
So I'll go first. I'm going to answer that question by saying focusing on the present has been really where I've been at, and I think that we're going day to day with our students to kind of get them through, but we also are experiencing predictability with all of this, and sometimes when we start to visualize what's going to happen and plan it out in our minds, it's completely different. So I'm focusing on now, and I think the future is still unpredictable, but it's concerning, and I think that we're going to have challenges that are, again, unpredictable. We may have kids that have really kind of gone backwards. We've made progress with them before we went out on quarantine, and then we're going to probably have to work through those things once again. But who knows? I think it's unpredictable.
Yeah, for me, current the current needs has definitely taken a lot of headspace for me to focus on, a lot of energy. I want to be engaged in the thoughts about reentry, the planning about reentry, because I think we have to be proactive about that. We have to consider, all the scenarios, I think, and be as prepared as possible. But meeting the needs of students and supporting teachers right now has definitely taken a lot of energy, and connecting with parents and just making sure that people have what they need as emotional caregivers and support personnel. So I'm starting to focus on the future and the reentry, but definitely put a lot of energy into the here and now and what's going on for me.
Okay. And I have to say that I sit on my district's reopening task force, and I have spent a lot of time focusing on the future, using what we've learned. One of our exercises was to actually focus, what was it that we learned these past 12 weeks? What did we do well? What could we have done better? What resources did we need? And then trying to establish what we think our priorities are when our students come back to us for this continuous learning, whether it's in a hybrid model or home or completely distant. So I actually have been focusing very much on that. That's been my focus these past, I would say, 3 or 4 weeks. We meet 2 or 3 times a week to kind of process this going on.
Okay. So as plans for a return to school continue to develop, what needs are you anticipating to be the most prominent among students and families?
Yeah, so just with that, since it's so much in my mind, I think we all recognize that, unfortunately, the school communities that we had built have been slowly eroding. The sense of belonging to a school, and those kids having, and those families having an identity to that school and to that school community has slowly been eroding. And so one of our primary goals, and I think many school counselors and other support service staff feel this way, is how do we effectively build more relationships? And beyond that, just that sense of, this is a place where people, this is where I belong. This is part of my identity. I think we have to get to that. And that will also help us with the piece that I mentioned very early on in this webinar about engagement. If I'm so tied to my school because that's where my identity in part comes from, then I'm going to be engaged. So we're really working on what kinds of exercises and activities as a community, whether it's in a hybrid model or not, what is it that we're going to do? And we're slowly getting to that. It's going to be a lot more work figuring that out, but very committed to it.
That's a great response. I think that really needs to be at the heart of what we're looking at, that connection, that community. I love that the state is, looking to roll out social and emotional standards, and my district in particular is making room and progress toward that as well, and making more space to do specific social and emotional learning across grade levels. And I think that's going to be crucial. Understanding that people are going to come back with a level of anxiety, both adults and students.
Yep.
And I think if we look at tragic events historically, the way we recover is gradually, right? We recover with a lot of support. There will probably be a strong push to bridge some of the academic achievement kinds of gaps that have been created by this pandemic, or that have existed and exacerbated by the pandemic. But I think understanding Maslow's needs, we have to meet a number of other needs before we can just jump back in. So providing adequate support for that, and easing in before the cognitive demands are just brought back 100%, having social and emotional supports to allow that to gradually work its way in.
Well, I really appreciate that Eileen is on the front line, organizing and planning going forth. And there's so much to consider. And the last thing that you said, Eric, just that, being able to come into school and consider social and emotional needs first. I think we know that we're going to have a lot of anxiety, staff and students. I think that we have to settle, and that pressure of the academics is going to need to kind of take a little bit of a backseat. That's what I think is what I'm anticipating the most. I think is the anxiety about what are the risks, what are the rules, what are the expectations, and I think that's going to come from staff and students. So creating kind of a support system and moving in more slowly than typically will be needed.
Thank you. So certainly educators have a shared responsibility to work collaboratively in support of students, and that's going to be very important during this time. If you were to speak directly to administrators right now, what might you share with them that you believe would benefit you in your work as a support specialist?
So I think that I would share with my administration some of the things that I felt went really well in terms of meeting our needs as staff and as myself as a professional for support staff person. So I think that we were provided with a lot of assistance very early on and very quickly with regards to the use of technology. Mm-hmm. And so I think that piece kind of out of the way quickly allowed us to jump in. And I really appreciate the administration for creating all of that, tutorials, that kind of thing, that were excellent. And the administration was always responding to requests to connect and talk about an issue. They responded immediately, any of the administrators during this period of time. So that is a really critical aspect of the need that we have from the social emotional standpoint. and checking in with staff and asking how they're doing is a really, really important part. We did eventually have regular staff meetings that were virtual, and creating that sense of community amongst the staff was really well received. But we didn't have it for a little while. We didn't have anything like that for a little while. But just being able for just the staff connecting and feeling as though they're part of a community was really important. And I think that going forward, creating a sense of community, and I think we already kind of touched on that, going forward, recreating a sense of community once again when we come back,
Right.
For the staff and for the students, and having some time for that. We actually hosted a community forum to discuss the response, to discuss the death of George Floyd. And it was extremely well received. And it created a platform that I think can be used even when we go back to regular school. The virtual platform was really, really effective for our community forum to talk about some really important issues with regards to what is going on in our country right now. Thank you.
Yeah, I think one of the benefits of having us all, mental health practitioners, teachers, administrators, we all bring a different lens that's valuable to see the whole child and to educate the whole child. So having the mental health practitioner lens, of course, is my piece of the puzzle, our pieces of the puzzle. And I think what gets measured gets managed. So I think I would encourage that we measure the social and emotional needs of the adults as we re-enter. How do adults feel? What sense of agency and capacity do our teachers feel in terms of being able to manage new protocols for supporting students with perhaps, especially younger kids? How do we socially distance? We're going to need reduced class sizes and perhaps one-way hallways and all of these things that our administrators will be, on top of. Will our teachers feel the sense of capacity and agency to support that? As we have educators who will be in greater at-risk ranges as well, do they feel safe and comfortable coming back to work? I think all of those things will, certainly be crucial. And then just the social and emotional needs that will be in the building community, as Sandra said, allowing people to have a voice into what they're feeling, and certainly the current issues in our society are affecting all of our kids and our educators, and with the level of trauma and the systemic racism issues and so many things that are impacting, and so just being aware that some of our kids, especially our minoritized children, our families of Black and Brown families, have a set of needs that we need to pay attention to as well, and how can we support them? So I think, a lot of things that I think our administrators are going to have to juggle. It's not an easy job, I know, but being aware of all of those issues systemically, all the way down to our personal connections.
And the only thing I would like to add to that, because both of you have, both Sandra and Eric have really shared a lot of good ideas for administrators to consider, is this one thought that this is all new to us, the whole experience. And because it's new, we need, as support services and other staff in the building, to know that we have the support of our administrators to try something new, and not to worry about whether we're being judged or this intervention didn't work. And I think feeling that support is very important, because we have to be creative. And if we're going to be creative, there's going to be risks involved. Trying something new. This is out of our comfort zone. So we need support for people to encourage us to do that, to think a little differently. So I would just, I think if administrators can encourage that, and also be mindful that we feel very, at times, ineffective these days. And please don't judge us for that. We want to do our very best.
So clearly, your work requires attention to a number of activities and the need to juggle multiple demands. Harkening back to the importance of caring for one's own needs in order to be effective with others, what advice would you give your colleagues on how to engage their own self-care while providing continued support to students?
Yeah, I've established a lot of rituals on the beginning, morning rituals, a lot of like hygiene kinds of things, trying to start my day with positive thoughts. But most recently, I've started more of like a nighttime to help me sleep, because there are some times that I feel restless and I'm doubting myself, right? So I do this as a need at this point. I have to think about what I call as like I probably heard it somewhere else, so I'm not trying to be the creator of this idea, but sort of acknowledging your wins of the day, every day. Who was it that I had a successful conversation with? Which family, what administrator, what's, colleague did I support? Did I make a difference? So it's just, even with your own family, acknowledging the wins. Well, I had a nice dinner for my family tonight, or I said a nice comment to my child when it was a tough moment. Just be good to yourself, acknowledge your wins. We can have a lot of negative conversations between our ears. Stay with it as you're trying to get some rest. Stay with that concept of, I've done some good things today. I've had good intentions, and really name them to yourself.
Mm-hmm. Absolutely.
I love that. For me too, just acknowledging some of those things or building habits out of some of those things that maybe I took for granted. I know people, who exercise more regularly than me, or who have perhaps gym memberships and things, that's a shift, right? So how do we establish a healthy habit without maybe the comfort or the facilities that we normally would? These are all really important. And Eileen, you mentioned something too, about judgment. And we do, many of us, it's human to have automatic negative thoughts, right? And to go down these roads when we're stressed or perhaps feeling guilty or shame. And I think using those things, I think guilt can lead toward positive direction, right? How we might move toward our values if we're feeling like, oh, maybe I didn't do that as well as I could have. But it can also lead to shame, which can be paralyzing. So I think really that positive reframe, keeping track of those positive things, because they go by the wayside if we don't. And if you think of some of those adages, like the behaviorism approaches, like that suggest we should have 5 positives to every correction when we're working with kids. We probably need to build that into ourselves, 5 affirmations for every self-critical thought or comment. And it's really crucial. We're sort of, I think, as Eileen and Sandra have both said, we're trying to figure this out without the benefit of having any context prior. So be kind to ourselves. I think and gracious to ourselves.
Thank you. I love what both of you have said, and I would echo a lot of those ideas. But I did want to share some ideas that I got from my colleagues, the other social workers in the technical schools in Connecticut, some of whom have young children around them, but just some of the ideas about how they got through this in terms of self-care. So it's a collection. So creating a structure and a workspace and a routine and sticking to it. that includes a start time and an end time of your workday, setting up those boundaries as early as possible. Try to set your meet times with students and stick to it so that you and they can develop that into their routine. And then taking the perspective that this is a new challenge. Yay, a new challenge. And that as social workers, we are problem solvers. So this has been a time to think outside of the box, do things another way. And one of my colleagues said, just remind yourself that everyone is trying to figure this out. And by everyone, this means the whole world. The whole world is trying to figure this out and is frustrated and is challenged. So eating, and sleeping, and doing something, daily exercise is really important. Yoga is amazing for your lower back. Sitting at your computer, stand-up desk option, or maybe a pillow or a box on your bureau, or maybe kneeling like Eileen. My family took on a 6-week-old puppy. We took family walks in nature daily. So I would say that dogs and walks in nature allowed me to recharge every day. And so that self-care was sort of designed at the beginning and pretty conscious in terms of what do I need to look forward to every day. And I think I talk that talk also to my students. What can you create every day that you can look forward to?
Thank you. So each of you have really shared some important information around how you've addressed these challenges. I'm wondering whether or not we might be able to find a silver lining amongst all of the challenges that we've been facing. So could you tell me if you believe there are any positive takeaways in light of our experiences over the last several months?
Absolutely. I think one of the things that's really important is, and it's also self-care, and it's also the validating that we need to do, is to realize that we've developed resiliency through all of this, and so have our kids, so have our students, our families. So we've grown in ways that we didn't know that we could, and our ability to tolerate discomfort and change has increased, as has our students. We bonded around this challenge. I think we bonded with our kids in a different kind of way, and our colleagues, maybe different colleagues than we may have bonded with previously, and different students. So we had to work closely to get there from a distance. I think we became more collaborative and maybe more efficient. We had a community forum, as I said before, online, and it was amazing. It would have occurred to us to have something like that before online, but the online platform was amazing, and people were able to speak and be heard and felt. I learned how to be friends with every kind of Google app, and I actually like them, and we will continue to be friends. I learned so much in that sense with technology. So I think that's the silver lining. We saved money on gas, and we got to bring our pets to work. I always wanted to bring my dog to work. So we had 2. So there were silver linings, and I don't know, there may be some things that we are doing now because we were forced to, that we're now going to say, well, we're going to keep that. Mm-hmm. So I think I'd like to see that happen. And there's hopefully we'll have those conversations, in our schools and in the leadership as we go forward with adapting to going back. Mm-hmm.
That's great. I think adapting is the perfect word, right? We've all learned how to do new things, right? For old guys like me, technology is sometimes a challenge. So, and I think educators have responded beautifully. I just am amazed at my staff that I work with, my administrators, down to paraprofessionals who've all been involved, to our food service people who've continued to support food insecurity, within our community. And so we've continued as a community, perhaps in different ways. But I think the biggest thing for me is just understanding that we're experiencing so many different emotions, but accepting these as signals, really, that are showing us what we care about, because they've led us to respond differently, respond more creatively, respond beautifully, in moving toward our values of supporting our students. So it just has a new format. It doesn't have four walls, but we've recognized that these emotions, these experiences, this pandemic has led us to continue responding toward our values of valuing children, of valuing families, of valuing education and educators. So we're able to continue demonstrating what's most important, and be able to do that in a new and creative way.
Yeah. I think my takeaway is, gosh, how important schools are in the life of not just the child and not just the family, but the community. Mm-hmm. And how, no matter what shape, whether we're brick and mortar or are we in some sort of remote capacity, how important the school is as a sort of a foundation for our society. And I felt really good about that. Then I thought about how important we are as support services. The roles that each one of us have slightly different roles here, as social workers, psychologists, and school counselor. And our roles are really important to have schools and communities function, to address not just our most needy, but everyone. I think we provide enormous amount of services. And then I realized, gosh, how much I like my job. Mm-hmm. I like what I do. And I like feeling effective. And I feel good about the community, the contributions that I have been trying to make, and will continue to try to make as we support all the needs that are out there. And I'm a very hopeful person, and so I think we can make a difference and continue to make difference to improve the situation that our students are experiencing. So.
Thank you, Eileen, Eric, and Sandra, for sharing your expertise and participating in this valuable conversation. By giving up your time, you have provided others with a window into your thoughts and experiences as we navigate this new normal together. I feel confident that the information you shared will resonate with many. Safeguarding one's own mental health is a necessary component to ensuring that the needs of others are addressed. And navigating stressful circumstances has become a collective necessity, requiring collaborative efforts as well as a focus on self-care. If you or others may be experiencing difficulties and might benefit from emotional support, assistance is available by calling 211 or utilizing the Substance Abuse Mental Health Services Administration Confidential National Helpline, which is 1-800-662-HELP. Again, that's SAMHSA's helpline at 1-800-662-HELP. Additionally, you may access a wealth of resources posted on the CSDE's website under COVID-19 resources for families and educators. I believe you will find this information to be helpful. Again, thank you for your time and attention, and remember to take care of yourself. Be well.